Millions of Americans right now, not in a developing country, right here in the US, cannot drink their tap water, cannot afford to see a doctor, and cannot pay rent on a full-time salary. And the craziest part, this is the richest country on earth. So, how does that happen? How does a nation with more billionaires than anywhere else on the planet end up with millions of its own people living without the basics? Because the problem is not that the money is not there, the problem is where it stops reaching. And once you see exactly where that line is and how close it runs to ordinary people living completely normal lives, you will not look at this country the same way again. Let's start with something almost nobody thinks to question. Water. You wake up. You walk to the kitchen. You turn on the faucet. Now imagine the water that comes out is brown. Most people's first instinct would be broken pipes somewhere nearby. A temporary service interruption. Call the utility company. Grab a few bottles from the store. Wait for it to clear up. Normal assumption. Reasonable reaction. Now imagine it does not clear up. Imagine that is just Tuesday and Wednesday, and the Tuesday after that and the one after that. That is the actual daily reality for families in parts of rural Appalachia, tribal communities across the Southwest, and struggling urban neighborhoods spread across multiple states. There are households in the United States where people simply do not use the tap for drinking water. They buy bottled water by the case. They haul containers in from other locations. Some rely on private wells that have never been properly tested for safety. And they do this not because they are uninformed. They do it because experience has already taught them that the water coming out of their pipes cannot be trusted. Here is where it becomes hard to explain away. According to the US Environmental Protection Agency, millions of Americans are currently dependent on water systems that are well past their useful lifespan. Many of the pipes delivering water to homes today were installed 50, 60, even 70 or more years ago. Replacing and modernizing the nation's water infrastructure is estimated to cost hundreds of billions of dollars over the coming decades. For large cities, that is a serious challenge. For smaller communities with limited tax bases and shrinking local budgets, it can feel genuinely impossible. So, repairs get delayed, projects get pushed back, and residents keep using the water they have because no one is offering them an alternative. But the part that really stays with you is not the infrastructure gap. It is that most people in these communities have stopped expecting it to change. When a problem exists long enough without any resolution, the mind starts to reclassify it. What once felt alarming becomes routine. What once seemed unacceptable becomes just the background condition of daily life. You stop calling it a crisis because calling it a crisis implies it is going to be fixed. In wealthier parts of the same country, water quality is not even a topic of conversation. You turn on the tap, you drink. But in poorer, more rural, more isolated communities, filling a glass from the kitchen faucet has become something people actually think twice about. And when you cannot trust something that basic, one of the most fundamental things a home is supposed to provide, it raises a question that goes well beyond pipes and infrastructure. If you cannot count on that, what can you count on? The modern crisis of American infrastructure and economic survival did not emerge overnight. It is the direct mathematical consequence of legislative choices and structural shifts over the last 50 years. To understand why a kitchen faucet in an American town spits out heavy metals, or why a full-time worker faces eviction, one must trace the line back to structural reconfigurations in the late 20th century. Between 1977 and 2017, federal capital spending on water infrastructure fell by an estimated 82% per capita. In the 1970s, the federal government funded over 60% of local water infrastructure project costs through direct grants, such as those authorized under the Clean Water Act of 1972. By the mid-2010s, that federal share had plummeted to less than 10%. The financial burden of maintaining compliance with federal water standards was shifted entirely to local municipalities. For structural reasons, this transfer of responsibility acted as a geographic trap. Cities with expanding corporate tax bases could absorb the cost, but regions suffering from industrial decline, mechanized automation, or depopulation were left with legacy systems they could neither afford to operate nor legally abandon. The dynamic is starkly visible in the history of the domestic manufacturing belt. When heavy industry moved production offshore during the 1980s and 1990s, municipal revenues collapsed. In cities across Michigan, Ohio, and Pennsylvania, water treatment facilities built to supply hundreds of thousands of manufacturing operations and households suddenly had to be maintained by a fraction of the population. The cost per capita surged. Local utilities, facing budget deficits, systematically deferred routine maintenance. According to data from the American Society of Civil Engineers, there is a water main break in the United States every 2 minutes, losing an estimated 6 billion gallons of treated water daily. In rural sectors, the geographic trap operates differently. Across the Central Valley of California and parts of the rural South, agricultural runoff containing nitrates and synthetic pesticides entered shallow aquifers used by municipal wells. Because small rural water boards lack the millions of dollars required to install advanced filtration systems, residents receive water high in contaminants. A parallel structural shift occurred in the domestic housing market. The current deficit of affordable housing is rooted in a fundamental divergence between wage growth and shelter costs that began in the mid-1970s. According to historical data from the U.S. Bureau of Labor Statistics, when adjusted for inflation, real median wages for the bottom 50% of wage earners remained nearly flat between 1979 and 2019, growing by less than 10% over 4 decades. Conversely, data from the U.S. Census Bureau shows that the median sales price of a home grew by roughly 120% in inflation-adjusted dollars over that same period, while median gross rents increased by over 70%. The structural gap widened rapidly following the 2008 financial crisis. As millions of foreclosed single-family homes were bought by institutional private equity firms, properties were converted into rental units managed by automated pricing algorithms. This corporate consolidation of low-income housing stock systematically drove up rental rates in metropolitan hubs at the federal level, the primary mechanism designed to assist low-income renters. The Housing Choice Voucher Program, established under Section 8 of the Housing and Community Development Act of 1974, was never funded as an entitlement. Unlike food assistance programs, housing assistance is strictly limited by discretionary budget allocations. As a result, only about 1 in 4 eligible low-income households in the United States receives any form of federal housing assistance. The remaining 3/4 are forced into the private market, where they compete for a rapidly shrinking supply of low-cost units. Municipal zoning laws further compounded the crisis. Throughout the 1990s and 2000s, local suburban governments across the country utilized exclusionary zoning policies, banning the construction of multi-family apartment buildings and mandating large minimum lot sizes for single-family homes. This legal framework artificially restricted housing supply in areas experiencing job growth, forcing low-wage workers into long commutes or severe financial strain. The modern healthcare crisis follows an identical trajectory of institutional commodification. The United States transitioned from a system of non-profit community hospitals to an integrated commercial healthcare market during the late 20th century. The introduction of the Emergency Medical Treatment and Labor Act in 1986 mandated that hospitals provide emergency care to anyone, regardless of ability to pay, but it did not regulate the subsequent medical debt. As costs escalated due to administrative overhead, pharmaceutical patent monopolies, and proprietary medical technology, health insurance premiums outpaced inflation. Between 2000 and 2020, average family premiums for employer-sponsored health insurance increased by 114%, vastly exceeding the growth in worker earnings. The introduction of high-deductible health plans in the 2010s shifts financial risk directly onto consumers. Under these plans, individuals must pay thousands of dollars out of pocket before their insurance coverage begins. This brings us to the core paradox of the modern American economy. The nation produces unprecedented macroeconomic indicators, including a record gross domestic product and a highly valued stock market, yet its internal systems contain deep structural fractures. The wealth generated by technological innovation, financial engineering, and corporate consolidation has concentrated in specific geographic corridors, leaving vast stretches of the country economically isolated. the transition from an industrial economy to a service and technology-driven economy altered the baseline requirements for financial stability. It created a system where access to clean water, reliable healthcare, and stable shelter is no longer a standard byproduct of full-time employment, but rather a variable commodity dependent entirely on localized wealth and institutional policy decisions. The structural vulnerabilities of the American economic model manifest most acutely in the day-to-day intersection of corporate practice, municipal failure, and legal framework. This reality is documented in public utility ledgers, federal enforcement registries, and county eviction courts. In the current landscape, the friction between regulatory intent and market reality creates distinct operational dead ends for millions of citizens. For example, the regulatory mechanism intended to ensure safe drinking water, the Safe Drinking Water Act, relies on state-level enforcement agencies that are frequently underfunded and susceptible to local industrial lobbying. A clear case exists in the widespread contamination of municipal water systems by per- and polyfluoroalkyl substances, commonly known as PFAS or forever chemicals. According to chemical registry profiles and EPA monitoring data, these industrial compounds, used for decades in manufacturing and firefighting foams, have infiltrated the water supplies of an estimated 200 million Americans. While federal regulatory limits were introduced to restrict specific PFAS compounds, the cost of installing granular activated carbon or reverse osmosis systems falls primarily on local water authorities. This creates an immediate clash between environmental mandates and municipal solvency. When local water districts raise utility rates to fund filtration, they inadvertently drive low-income residents into utility debt. In cities like Chicago, Baltimore, and Detroit, thousands of residential properties face water shutoffs annually due to unpaid utility bills, creating localized public health hazards. A parallel conflict exists between state authorities and corporate agricultural operations. In states like Iowa and North Carolina, concentrated animal feeding operations generate millions of tons of waste that leach into local watersheds. State regulatory agencies, constrained by legislative statutes favoring agricultural commerce, frequently issue variances that permit continued operations despite measurable increases in downstream nitrate levels. The population influx into the Sunbelt states has further strained municipal capacity. In rapid growth metropolitan zones across Texas, Arizona, and Florida, the expansion of suburban housing tracts has outpaced the construction of wastewater treatment infrastructure, leading to localized groundwater depletion and system overloads. The collision between economic necessity and infrastructure failure is equally visible in the domestic transportation sector. Because urban planning models throughout the Mid-Atlantic, Midwest, and Western regions prioritized automobile infrastructure over public mass transit, the modern low-wage worker faces a mandatory capital investment in vehicle ownership. Data from the Bureau of Transportation Statistics reveals that the average annual cost of owning and operating a new vehicle exceeds $10,000 when accounting for fuel, insurance, maintenance, and finance charges. For an individual earning the federal minimum wage of $7.25 per hour, or even a median service sector wage of $15 per hour, this expenditure consumes a disproportionate share of net income. When a vehicle suffers mechanical failure, the worker faces an immediate choice between entering high-interest predatory debt or losing employment due to absenteeism. The predatory lending market fills this gap via title loans and buy here pay here dealerships, which frequently charge annual percentage rates exceeding 100%, locking low-income commuters into a cycle of asset repossession and financial instability. In the housing sector, the conflict has escalated into a direct confrontation between corporate landlords and municipal tenant protections. During the post-2008 consolidation, institutional investment firms acquired substantial portfolios of multifamily and single-family rental properties. According to housing court registries, corporate landlords utilize corporate law firms to streamline the eviction process, using automated systems to file for eviction immediately upon a tenant missing a payment deadline by more than 72 hours. In metropolitan centers like Atlanta, Phoenix, and Houston, eviction filing rates in low-income zip codes frequently exceed 20% of rented households annually. While some municipalities attempted to introduce right-to-counsel laws for tenants facing eviction, state legislatures have countered by passing preemption laws that prohibit local governments from enacting rent control, eviction moratoriums, or mandatory landlord-tenant mediation. This institutional gridlock leaves the tenant population highly vulnerable to sudden market shocks or minor income fluctuations. The culmination of these systemic pressures is recorded in the rising rates of medical debt and bankruptcy. The United States remains the only major industrialized nation where medical expenses constitute a leading cause of personal bankruptcy. According to a national study published in the American Journal of Public Health, approximately 66.5% of all personal bankruptcies are tied directly to medical expenses, either due to the high cost of treatment or time missed from work during an illness. The implementation of the Affordable Care Act expanded insurance access, but it did not eliminate the financial vulnerability associated with underinsurance. The proliferation of out-of-network billing practices and high deductibles means that an individual can possess health insurance and still receive a balance bill for tens of thousands of dollars following an emergency hospitalization. The collection actions pursued by major healthcare systems include wage garnishments, bank account levies, and property liens against patients who cannot liquidate their debts. The institutional gridlock is further reinforced by the structure of the domestic credit reporting system. A single missed utility payment, a medical bill sent to collections, or an eviction filing is instantly recorded on a consumer's credit profile. This negative notation lowers the individual's credit score, which directly increases the cost of future borrowing, raises insurance premiums, and disqualifies the applicant from securing standard rental housing. The system functions as an economic trap, where the financial consequences of a temporary crisis are institutionalized, making it structurally difficult for the individual to regain stability. The intersection of these separate crises creates a compounding effect, where the loss of one resource systematically triggers the collapse of the others, leaving millions of individuals navigating